So the second part of it is, what is this sensory integration therapy which we are saying? So Gene Ayers is a person who introduced this. His concept was, if all the senses are properly developed, then the child's development is going to be proper, which will result in a good speech, good socio-personal interaction, good play patterns, everything. But if there is a deviation in this sensory development for whatever reason, then the child development may not be normal. So the remediation is also the reverse. So we are trying to integrate all these senses by giving him different kinds of activities where multiple senses should be involved, and then his attention will improve, his reception will improve, and then his overall development will improve. This is the basis of a sensory integration therapy. For example, to make it more easy, see, for example, if you are learning to drive a car, you need to use so many senses. You need to be very keen with your visual sense. You are seeing in the rear view mirrors, side mirrors, who is coming, who is going. You need to be alert with the hearing, who is horning, what kind of sounds, is there any abnormal sound in the car, etc. Then your tactile sense, how much you should hold the gear rods or your steering, how are you holding and how you should drive, etc. And your joint sense, how much brake you should apply, how much of accelerator you should apply, all this is your joint sense. And your overall spatial orientation, like which side you are supposed to go. Are you supposed to go on the right side, left side? If you want to cross, then how will you plan, how will you take a U-turn? All this is your spatial orientation. And then you have this sense of balance, like suddenly you are taking a U-turn, you know how to control the car, etc. So all these senses, if they are functioning well, only then you can drive smoothly, you can drive freely, and you can drive happily. Only when you do all these things, you can enjoy your ride. And then maybe whatever your friend is saying, sitting behind, you are actually listening, conversing, discussing, and then this ride becomes like a unconscious. Most of us actually are not conscious while we are riding. Everything goes on unconsciously. You are just chatting, listening to songs, etc. But if you are finding difficulty in any of these, then driving becomes really messy. You cannot really concentrate, you are not enjoying, you are not relaxed, you feel so stressful. Till the time you reach your house, you are almost like panicking. So if anybody says anything while you are doing that, you are not even listening, or you are shouting at them, or you are getting restless. So the same thing is happening with the child. So his senses have not developed due to whatever reason, whether it was an inherent problem or whether it was extrinsically deprivation, but his senses didn't develop, or one sense is hyper developed, one sense is hypo. Then see, for example, if his visual sense is so hyper that every tiny thing he is seeing. So in the mirror you are seeing somebody who is coming at the end of the road, and you are panicking, or your complete concentration is, what is that, who is coming, then you cannot drive smoothly, right? So you will ignore the rest of the senses. So you should know how much you should use the sense. So in the sensory integration therapy, what they do is, they are mainly concentrating on three senses: tactile, vestibular, proprioception. So they will create activities in which the child has to use all these senses in a coordinated way. I will give an example. They will create an obstacle path where he has to jump, and he has to slide, and he has to make a balance of himself, crawl in the tunnels, and simultaneously he is collecting the balls, or he is picking some things from the water bins or anything like that, or a sensory bins are put and he is picking the things, and he is collecting all of them and coming and dropping in one end. So here he is integrating vestibular, proprioception, tactile, and maybe even visual, because colorful things are kept and all, and he is following the instructions of the person also, so some amount of auditory input is also going on. So multiple ways he is integrating, and he is doing a task. So this hyperactive or impulsive child, or a child who is completely in his own zone, now has to use all his senses while doing this activity. So slowly over a period of time, he will learn how to use it in the best possible way, and then his attention will develop, and then his reception will develop. So this is the basic foundation. So second example I can give, on the swing you can keep the child. While he is swinging, you are giving him sandbags and asking him to throw at a bin at a distance, like a target hit. So in this swing is like a vestibular, sandbag is like proprioception, and how much you have to gauge is also proprioception, and the texture of a sandbag is like tactile stimulation, and the colored sandbags are visual stimulation. So, all these together you are integrating and making an activity. These are just two examples. There will be multiple activities, and a good occupational therapist will combine one activity which the child likes or seeks with one activity which the child avoids. For example, he is scared of swings, but he likes the rest of the activity. So, he will introduce the swing in this activity, so that once he is swinging, you are giving textured things, so that his concentration is now more on the texture. He is doing things with his hands, and he is dropping things or making sounds with some whatever toys or activities, and he forgets his fear of the swing slowly in a gradual way. This is a good occupational therapist, how he should plan his activities. So, this all will come under sensory integration therapy. So, now we do not have a choice to have all these therapies, or that cost is prohibitive, or we cannot take it for a long time. Can't we do anything at home is the next question. So, definitely there will be lot of activities which the parents can do at home also, but you should understand what is your child's preference, what is that he is avoiding, and only then you can plan accordingly.